A few years ago, a man in his early 70s sat across from me in my clinic. He looked healthy, sharp, still active, but his voice dropped when he said, "Dr. Jocelyn, I've been doing this the same way for 50 years. Lately, something feels off." He wasn't sick. He hadn't started new medications. Nothing dramatic had happened. And yet, what was quietly affecting his energy, his circulation, his prostate comfort, and even his ability to feel pleasure was something he never suspected. Not masturbation itself, but how he was doing it. And like so many men over 60, he had no idea that certain long-standing private habits can slowly work against the body as it ages. I'm Dr. Jocelyn, a urologist with 5 years of experience helping men over 60 maintain strength, circulation, and confidence without shame, gimmicks, or confusion. You've probably heard that masturbation is healthy, and it can be when done right. But after 60, certain habits that once caused no problems can quietly become harmful without pain, without warning, and without obvious symptoms. Today, I'm going to walk you through 7 masturbation mistakes older men commonly make, and more importantly, how to fix them before they affect your vitality, performance, or long-term health. And please stay with me because mistake number 6 is the one almost every man gets wrong. Before we begin, take a second to like this video so more men can find it. Subscribe and turn on the bell. I share real, medically grounded insights for men over 60 every week. And tell me in the comments, where are you watching from? I love seeing this community around the world. All right, let's begin with a truth most men have never been told. Here's the myth. Masturbation is always healthy, so how I do it doesn't matter. That's not entirely true, especially after 60. As we age, the body becomes less forgiving of habits that overload the nervous system, restrict blood flow, or disconnect us emotionally from sensation. Your brain, your blood vessels, your pelvic muscles, and your hormonal rhythms all change with time. So while the act itself isn't harmful, certain methods quietly interfere with circulation, nerve sensitivity, and recovery, the very things erections and pleasure depend on. This isn't about guilt or fear, it's about adapting wisely. In my work as a urologist, I've spoken with hundreds of men in their 60s, 70s, and beyond. Many come in worried about reduced sensation, weaker erections, pelvic discomfort, loss of confidence, feeling flat afterward. And again, I see the same pattern. The body isn't failing. It's responding to habits that no longer fit its current physiology. When men understand why this happens and make small, respectful adjustments, the body often responds beautifully. So let's walk through the 7 mistakes, one by one, biologically, emotionally, and practically. Mistake number 7, using porn as the primary stimulus. Over the years, I've heard many men quietly say, "Doc, I don't feel much anymore." They assume it's age. Often, it's not. Biologically, after 60, the brain's dopamine system, the system responsible for pleasure and motivation, becomes less flexible. It doesn't rebound as quickly from intense stimulation. High-intensity visual content floods the brain with novelty, clip after clip, scene after scene. The brain adapts by numbing itself. Real touch begins to feel dull. Intimacy feels distant. Pleasure becomes mechanical. This is called dopamine fatigue, not aging. Emotionally, men often feel confused or discouraged, thinking something is wrong with them. Practically, the fix is simple but powerful. Take a 14-day break from visual overstimulation. Relearn arousal through touch, breath, and presence. Let the nervous system recalibrate to natural sensation. Many men are shocked at how much sensitivity returns. Mistake number 6, masturbating. While sitting on the toilet, this surprises a lot of men. For privacy and convenience, the bathroom becomes the default space. But here's the hidden issue. Biologically, sitting hunched forward compresses blood vessels and nerves in the pelvic region. After 60, circulation is everything for the prostate, bladder control, and erection quality. Prolonged pressure in that position restricts blood flow exactly where you don't want it restricted. I've seen men develop pelvic tension, groin aches, weak urinary flow, dribbling after urination without realizing the habit that contributed to it. Practically, change the environment. Stand, recline, lie down. Give the pelvis space. Your circulation will thank you. Mistake number 5, rushing the experience. This is extremely common. Many older men treat self-pleasure like a task. Let's just get this over with. But rushing sends the nervous system the wrong signal. Biologically, rushing spikes heart rate and stress hormones. Blood vessels constrict instead of relaxing. The body never enters the calm, oxytocin-rich state that supports healing and satisfaction. You may climax, but you feel drained afterward. Emotionally, pleasure becomes shallow. Connection fades. Practically, slow down. Let arousal build gradually. Focus on breathing. Allow the body to open, not tense. After 60, the nervous system thrives on calm, not urgency. Mistake number 4, ignoring the pelvic floor. Most men have never been taught about this. The pelvic floor is a group of muscles beneath the bladder and prostate. It supports erection strength, ejaculatory control, bladder control. When it weakens, everything above it suffers. I once treated a 68-year-old former firefighter, fit, active, disciplined, yet struggling with sexual function. The issue wasn't his heart or hormones. It was a disconnected pelvic floor. Biologically, weak pelvic muscles reduce blood trapping and nerve signaling. Practically, during arousal, gently contract the muscles you'd use to stop urine midstream, hold for 2 to 3 seconds, release, repeat a few times. This improves tone, awareness, and circulation. Mistake number 3, getting frequency. Wrong too much or too little. This question comes up often. How often is healthy? After 60, extremes cause imbalance. Too frequent. Prostate irritation, lower energy, slower recovery. Too infrequent. Reduced blood flow, nerve dullness, tissue stagnation. Biologically, the body thrives on rhythm. For many men, over 60, once or twice per week, done mindfully, supports circulation, hormonal balance, sensitivity. This isn't about rules, it's about listening. Mistake number 2, using too much pressure or force. As sensitivity decreases, many men instinctively grip harder. That instinct backfires. Biologically, excess pressure causes microtrauma, nerve irritation, scar tissue, reduced elasticity. Over time, it can even contribute to curvature conditions. Force does not restore feeling, it erodes it. Emotionally, tension replaces relaxation. Practically, be gentler. Use lubrication. Focus on blood flow, not friction. Let sensation build naturally. Patience restores responsiveness far better than pressure. Mistake number 1, masturbating without emotion or intention. This one matters deeply. Over time, self-pleasure can become mechanical, empty, disconnected. When that happens, the brain stops releasing oxytocin, the hormone of connection and calm. You may climax but feel hollow afterward. That's not age, that's disconnection. Even solo touch can be grounding and restorative. Practically, slow your breathing, stay present, approach the moment with gratitude rather than escape. When emotion returns, the nervous system heals in ways medicine can't measure. Here's a simple, respectful reset. Reduce visual overstimulation, change positions to support circulation, slow the pace, engage the pelvic floor gently, find a balanced rhythm, use lighter touch, bring intention and presence back. These small changes protect sensitivity, blood flow, prostate comfort, emotional well-being. If this video resonates, I want you to hear this clearly. You are not broken. You are not past your prime. Your body is simply asking for a new kind of attention, one based on awareness, not habit. When men respond with respect instead of fear, pleasure often returns, confidence returns, connection returns. Aging is not the end of vitality. It's a shift in how you relate to your body. Slow down, be curious again, listen. If this video helped you, like it, subscribe, share one habit you're committing to change. I'm Dr. Jocelyn, and every week I share grounded medical insights to help men live stronger, longer, and more connected lives. Remember this, your best years aren't behind you. They're shaped by how you care for yourself now.